My goal as an integrative primary care doctor is to see patients in the office, put a Band-Aid on certain illnesses, empower change, and then hopefully prevent the catastrophic occurrence of that illness or progression of the illness. The same thing can be said in the sports medicine world. I used to be one of the team physicians for University of Central Florida. Great school, Division I, very competitive. I would do the same thing with my athletes. In the training room, I'd see athletes with the beginning of an injury. Hopefully not full-blown, but we would try to work with the athletic trainer, change around the activity, encourage healing with proper nutrition, maybe anti-inflammatory medications, and then get that student back to athletics as soon as possible, in addition to having them continue with schoolwork. There was a lot of controversy in the 80s when it came to supplementation, like protein. There is definitely a lot of controversy that kind of continues to roll over, especially in the school-age people. If you go to your average Planet Fitness, Charter Fitness, Lifetime Fitness gyms, and I talk to, say, some of the weekend warriors, midlife guys, they'll have the same questions as my athletes in school, whether high school or college. And it's, how should I take protein? Where should I buy protein? How much should I be taking? So that's what I wanted to do this for, is to enlighten my folks about what to do. Protein supplementation, again, has always been controversy. If you are cutting down, there are a lot of weight loss protocols that use protein supplementation in shakes, froth it up, add fiber, and that's supposed to be the meal replacement plan. And that's good for a short amount of time. It's not healthy it's not human to maintain powdered liquid for life. Humans are hunter-gatherers. We're supposed to have all sources of food, but mostly whole food, plant-based diet, no matter where you go in the world. Now, if you're an athlete, you definitely want a clean and green, some kind of clean and green nutrition plan. I usually say that because, especially with what we know in midlife, we usually take with us from college. And what my college guys what I see my college guys practicing is usually poor nutrition. Now in Division I, when you have a scholarship, usually you get a little meal card that pays for everything. 7 days, 3 meals a day, and that's kind of cool. So the problem is you can eat all you want, and some of my football players at UCF would just chow down on steaks thinking there's no other protein, and that would be a creatine source too, but they would probably take in more creatine anyway. But the idea is that with all that meat, you're probably going to have a problem with cholesterol sooner or later. It initiates in college and then it blossoms, hopefully not into catastrophic levels, but blossoms when you hit midlife, especially if you don't make any changes. So the idea is always, if you do take a protein substitute, even if it's BCAAs or branched chain amino acids, which supposedly are great building blocks for taking care of inflammation, but most of the studies out there show that it doesn't really change the recovery time. You know, evidence-based medicine always has to be relied on when I, as a physician, have to make suggestions to my patients. I have to be better at nutrition than my patients. And if I'm not that great with nutrition, then or if I can't answer the questions, I send over to my registered dietitians. But somebody that has studied and made a lifetime of education in the nutrition world and how it fits into healing really has to give you a heads up on what you should be spending on and what you should be looking out for. I have a police officer that was taking a supplement. It was supposed to be protein source in addition to something to encourage more energy. And I read the label myself when he was in the office, and it looked okay. But I got his blood test back, and lo and behold, his blood test pattern looks like he's abusing EPO. And for those of you who know Lance Armstrong, or at least cyclists, EPO, they don't even have to test for EPO. If they find that your hematocrit's high and your kidneys are kind of backed up, you're using it. And forget the competitive part, it's dangerous. So I'm not saying that with my one police officer, that is because of the supplement, but you got to be careful. Anyway, he said he had a great buzz and he had a really good enthusiasm when he used the protein powder that he chose when he worked out, and he noticed muscle gains. But this is where evidence-based medicine comes in handy. At University of Central Florida, there's a guy in the exercise physiology department. He used to play pro football. He's now one of the researchers, Jay Hoffman. He had presented a paper in 2006 showing a small study, 23 athletes, and he tested the athletes for 12 weeks. he gave them different levels of protein. He gave them below recommended levels, he gave them recommended levels, and he gave them above recommended levels. He divided into 3 groups. And then he told all the athletes to submit a weekly diet diary. Over the 12 weeks, he measured there are some hormones that you can get from the blood to measure testosterone level, cortisol level, something called IGFA, and there was no change in any of the groups. And again, they were all given the same exercise routine. I'll see if I can put a link here to show you the study. Yes, it was a small study, however, it's still a good one. It gives you an idea that maybe we should get more studies or a bigger population, but bottom line is that there's no change in the overall size or fitness level of the strength athletes. So whether they used less than, or the recommended dose is, the middle ground or recommended amount of daily protein intake is 1.4 to 1.6 grams per kilogram per day. Lower than that, like 1 gram per kilogram per day, or higher than that, like 2 or more. Again, we would think as typical athletes, you do more, you get bigger faster. But nothing came about with the end of the result. That was 12 weeks. 12 weeks is usually what I tell my athletes to shoot for in a lifestyle change. I tell them to empower themselves, try to make a lifestyle change for 3 months straight, and hopefully, if you can keep it up with your coaches, the eyes in the field that I use, then you will probably have this engram developed, or you'll probably have some very good coping skills developed to have you continue on. The problem is always going to be when you have a interruption in that lifestyle change, or if you're taking things that aren't necessarily helping you, you're wasting time. So not only are you wasting time, like in the story of the police officer, you could be actually endangering yourself. So if you have to take protein supplement, fine. I would not go over 1.4 to 1.6 grams per kilogram per day. And as far as when to use it, you can probably the standard is to split it. Half of that before and half of that after your workout routine. But truly, if you can get all that stuff from a whole food, plant-based diet and have a registered dietitian or a nutritionist plan your meals for you, then that would be great. I have a mixed martial artist who actually has a registered or a nutritionist plan her pre-fight nutrition, her fight nutrition, her post-fight nutrition, and even supplementation, and she's doing great. So whether it's her natural tendencies or genetics to do great, or whether that's the supplementation, or whether it's a supplementation that's letting the genetics unfold for her, doesn't matter. But not all of us can afford that. Not all of us are pro fighters with big paychecks. So the other option, aside from the protein that I really like to embrace, is using whole foods. So if you look at chicken and or turkey, try to go organic, but it's a good option. Again, you're gonna have to look up the milligrams or grams per day as far as the division and how these equal out, but I'm just gonna show these to you. Poultry, always good. 3 of these is about 15 grams. Cage-free, please. If you can get fish, better off. These are what I refer to as go-bag foods, because you can put them anywhere. I wouldn't leave these in a car, heat these up. But you can eat these on the run. I have these in my office just in case I'm running behind or I forget my lunch or my meal. The only problem with fish in a can is there are BPAs that sometimes get released into the meat, and it stinks. So I've been scolded by my staff on not opening this, so I have to go eat it outside. That's okay, I like getting out to nature. If you have to go with beef or pork, try to go with really lean cuts, or take it yourself and cut all the fat out, so it's mostly just red. And try to get grass-fed beef. Pork, it's not really, you can't really feed them grass, but you have to take care. So make the choices properly. If you can steer clear. I mean, this is still part of the Mediterranean diet. It is part of the anti-inflammatory diet by my friend Andy Weil, but if you can steer clear of the pork and beef and go more with what I just mentioned, you're better off. There's also tofu. I'm a semi-vegetarian. I use tofu as much as possible. I don't think the research out there shows anything bad with the correlation between tofu or soy, the legume, and then cancer of the breast. So if you're in full-blown cancer and you're going through chemotherapy, I'd probably avoid the tofu or the soy. But if you don't have that, I think non-processed tofu or soy, or minimally processed tofu or soy, is a great substitute. You can have the same kind of protein, equal doses of protein from either the plant or the meat, and you have less of the side effects of the meat. So those are important things to remember. The problem if you're an athlete is that if you have no choice but eating at the cafeteria, you're a prisoner to whatever they cook. And most high schools, forget it. You're going cheap with the high schools. Most high schools don't have that much money, so they have to go cheap too. So vegetables usually, anyway, if you can pack your food better, if you can learn how to cook better, if you have a parent at home that can help you cook with preparing on Sunday, everything for the next 5 days, that'd be good. It does take planning, but so does a lifestyle change in regards to getting healthy and avoiding the catastrophic endpoint. Same thing, if you want to not avoid necessarily an endpoint of catastrophe, but you just want to embrace and get your genetics to fully display what they're supposed to do, which I think is a miracle. Everybody has this possibility of having every cell in their body work miracles. I think we just expose ourselves to too much crap as far as nutrition, the wrong kind of activity or lack of activity, and then no relaxation practice. When you have no foundation for better health, what do you expect is going to happen? So the idea again would be, I like the projection that most of my young athletes or my middle-aged guys that are making a change, guys and gals are making a change. I like the way they're thinking, but you have to be careful about what you read on the internet. I do not think you have to do the protein substitutes unless, or the supplements, unless you do have a true deficiency. If you have a deficiency, that's where you use a supplement. But if you have no deficiency, try to go whole food, mostly plant-based. There are some natural deficiencies that we always find in athletes, or anybody. Usually it's vitamin D because of the low amount of sun exposure, especially north of Georgia, and then omega-3 fish oil. Most of the processed food or a standard American diet's low on omega-3, high on omega-6. That's pro-inflammatory, so you want to avoid that or supplement with it. Hard to check that level of omega-3 in the blood, but there is one lab that does it. Anyway, that's my take on protein supplementation. If you need it because you want to make a change and you want to go through a little bit of a lifestyle push or nudge, fine. Do it for 3 months, but plan at the end of 3 months when you reassess and go through what I call the float phase for the next 3 months. Try to get onto the natural stuff. If you do a well-balanced protein, carbohydrate, and fat plan 4 times a day, 7 days a week, you don't need any other supplements. If you need the supplements in the beginning, fine, but try to work your way to no supplementation, mostly whole food, plant-based diet, some form of cardiovascular and strength training exercise, and then a relaxation practice. That's my suggestion.